Welcome. Karen Davis from the Commonwealth Fund. It's a great pleasure to moderate this session on health services research was used and helped inform health reform. When I look back at the program of past AcademyHealth sessions, we always had sessions on the need for health reform, public opinion about health reform, policy options for health reform, the benefits, costs, and consequences. Now there's a big hole in the program, and we don't have sessions about the need for health reform because health reform is now the law of the land. It was terrific being at the signing ceremony in the Interior Department when Congressman Clyburn said, "This is the Civil Rights Act of the 21st century." And I think for all of us who have spent our entire professional lives, in my case the last 40 years, working on health reform, it is truly a historic accomplishment. And so this session is in some ways taking time to celebrate this achievement because despite how politically contentious health reform was, as Julie Rovner noted in her keynote address yesterday, I think that the field of health services research can be proud that our research played a significant role in informing the debate on health reform. And we'll hear that from our panel, Kathy Shane, Senior Vice President at the Commonwealth Fund, Jonathan Gruber, Professor at MIT, Mark McClellan at the Brookings Institution will all go through different aspects of health reform and the importance of health services research. And they will be followed by two congressional staff who are absolutely pivotal in the enactment of health reform. Jack Ebler, who's now with Health Policy Alternatives, but helped staff the House Energy and Commerce Committee chaired by Congressman Henry Waxman, but was also behind the scenes an invaluable resource to Speaker Nancy Pelosi. And then from Liz Fowler, who chaired the staff, head of the staff work at the Senate Finance Committee for Senator Max Baucus, but also helped inform the deliberations by Majority Leader Harry Reid. So this session is in part looking back, but those of you who know me know I'm never content to look back, always want to look forward. So I hope you will think about the issues going forward as you listen to these presentations. And being here in Boston, I'm struck by the fact that when Massachusetts enacted health reform in 2006, Massachusetts healthcare leaders said that the campaign for health reform had just begun. So we can't afford to sit on our laurels. We really all have to come together and work to realize the potential in this health reform legislation. So at the national level, I think there are at least four things the health services research community can do. First, to educate everyone about what health reform will and will not do. A surprising amount of lack of information or misinformation, and all of us who are dedicated to evidence-based policy need to be part of the process of making sure that this reform legislation is clearly understood. Secondly, we need to bring health services research to bear on the very thorny implementation issues ahead. So much was resolved by legislation, but much more needs to be resolved as this moves forward through the implementation phase. Third, we'll need research on tracking the impact of health reform, a lot of work on evaluating the many provisions in the legislation. And I would say for those of you who are more focused on methodology, we may need new methodologies to really get fast information that will help inform continuous learning and improvement as we go forward. And then finally, and I say this partly as a funder that always has to fund research that will yield fruit a year and a half to 3 years down the line, we need the Health Services Research Committee to be looking ahead to the longer term issues. So whether that's the issue around harmonizing public and private provider payment, whether it's issues around delivery system change, issues around the safety net, issue around affordability, whatever your particular area of interest and expertise is, we need to really be looking at what's next. Many may be exhausted, including some at this table, about what it took to get health reform. The president said he wanted to be the last president to have to deal with this issue, but I think we all realize that every president going forward will have to deal with this issue, and the Health Services Research Committee will have to be there to help them.